Regarding station 5, so I always talk about the skills. So station 5 we have 7 skills to be assessed, right? And we have two station 5s, and each of the station 5 carry 28 marks, 4 marks for each of the 7 skill. So in station 5A, 7 skills are assessed, which are the clinical communication, clinical judgment, patient welfare, and addressing patient concern, examination scheme, identifying physical sign, and other one is the last one is the differential diagnosis, right? So our scheme for the station 5 must be very precise, and we must uh, complete our history within 2.5 minutes or maximum 3 minutes. So we can make the scheme of after entering, because when we enter the room our 8 minutes start, right? We have total 8 minutes with the patient, and without any gap examiner discussion is started. So after 6 minutes examiners let you know that 2 minutes are remaining. Okay, so if we practice while practicing with your study partner, try to cover the history in within 2.5 minutes or maximum 3 minutes, right? And you after introduction confirm the identity and take the consent that I'm here to talk to you and examine you. Is that okay with you? Then ask the first open-ended question, that what brought you here, or if there is something given in the history like any shortness of breath or any headache, ask about that. Do the complete analysis of that complaint, making the short sentences, right? Do not spend a lot of time in making whole of the sentence. Try to make short sentence of just 3 to 4 words, like do you have any headache, any headache you have, any problem with your vision, right? In this way you can ask. Then move to the second open-ended question, is there anything else, or do you have any other problem? Or if you are dealing with any spot diagnosis, so at that time you can ask that any particular family history you have. So like in any spot diagnosis case of neurofibromatosis or tuberous sclerosis, if from the outside it is obvious that you are going to face this, or when you enter the room you see that patient is of tuberous sclerosis or neurofibromatosis, so you can ask on this very early, because there is no proper scheme for history and there is no stepwise approach in station 5. You can do anything which you like first. So if you think that it is about the any familial disease, right? So you will ask any family history you have. Then if no spot diagnosis or no familial disease, then ask about any other complaint you have. Then keep the category of just asking for the constitutional symptoms or just a few general questions. You can modify according to your case. Of in general, you can keep fever, fatigue, weight changes, skin rash or joint, and you can add any 3 or 4 in your scheme according to your scenario. For example, asking for the fever in any case of the rheumatology, right, in abdomen, or any rash like this. If you ask for the fever, then it means that you are ruling out infection. Okay, and same with the other 3, you can change that. And if you ask about any weight changes, so it means that if the patient is having some history which is suggestive of cancer, or it is not suggestive of cancer but it resembles cancer, so maybe at the end the surrogate can ask you, is it cancer? So if you have ruled out that red flag, in that case it will be helpful for you, right? So next would be, we will ask for any particular family history if we haven't asked it before, and ask for the, are you taking any medicines, or do you have any medical problem? So can you show me your medication list? Straightforward, ask for the medication list. Do not waste any time in station 5. Usually if the patient are taking any medicines, they have a very small paper with them in their hands, so they show you and you can read from there that which medications the patient is taking, and ask about the compliance with the medication, any recent change in the medication or any new medication, right? Or and any, or are you in regular follow-up with the concerned doctor? Or if you are dealing with any any chronic illness like high blood pressure, so always ask about the for the hemoglobin A1C. So you can ask it, do you know what is the reading of 3 monthly blood sugar was? Okay, so that is important. And then after the medication history, in the if in the medication list there is some medicine which you do not know that what this medicine is for, so you can ask the patient or surrogate, say, can you please tell me for which disease you are, which medical condition, your which health problem you are taking this medicine for. So patient will tell you in that case. Okay. Then next comes, there are two ways. If you think that you are short of time, and with the practice, you will definitely would have an idea that how much time has been passed. So there are two options. Either you can start your examination after doing this, because till then you would have reached your diagnosis. Next important part is the clinical examination, and this clinical examination carries 8 marks. 4 marks for the scheme you do in the station 5, and 4 other marks are for identifying the physical signs. Okay, so if you do not do any irrelevant examination, and you do it with a proper scheme, so you will get 4 out of 4. So it is not good, like if in a case of you are suspecting to have, you can say the patient of cardiology. So if you do the abdominal examination, or you do the pronator drift and proximal myopathy, and then you move to the heart precordium, so it means that you have done the irrelevant examination, and they will cut your marks in this. So be relevant and specific in station 5. And while you are doing the case, you are doing the examination, in your brain, just pick the positive finding, so at the end you can present your case with a positive finding, because on the basis of that you have to tell the examiner about the diagnosis. Most of the time in station 5 we have to tell the diagnosis rather than the differential diagnosis. Okay, so history, just spend not more than 3 minutes, then physical examination and identifying physical signs. You have to spend a lot of time in practicing for the scheme of the station 5. There are very limited cases. So you can, if you do daily practice of these, like one day you can just practice the scheme for the rheumatology, because the rheumatology scheme would be same for all the seropositive and negative arthropathies. Okay, and the other day you perform the respiratory examination scheme for the station 5, and same with the cardiology and miscellaneous and all the things, right? Because it is not possible to do the complete examination in a station 5. So you just try to finish your examination within 2 minutes for station 5. And if you haven't asked, then sit. When the examiner tells you that 2 minutes are remaining, it means that you have used the 6 minutes. You just have 2 minutes. Just sit there and ask for the patient concern, and take the social history as well, if you haven't taken it before the examination. Or if you think that you know from the outside that this, I'm going to face this case in the examination. Okay, so you can take the social history before going for the examination. It is up to your choice, right? So it asks 2 times the patient concern. And for the closure, I have already shared a file that for the closure you must practice that for station 5, within 30 seconds you must be able to tell the patient that what the patient is having. For the autoimmune diseases, there is no need to go in more detail about what the defense system is, or it is normally this is for this. You can just say there is some overactivity of the defense system which normally acts for the body, but in your case it is acting against your body, or you can specify the particular part of the body which having the problem. For example, in the rheumatoid arthritis, you can say that there is some overactivity of the defense system which normally acts for the body, but in your case it is acting against the lining of your joints, that is causing your joint pain. Or for the celiac disease, you can use the same sentence that there is some overactive activity of the defense system, which normally acts for the body, but in your case, it is acting against the lining of your bowel that is causing your symptoms. So what we will do some tests, some of the blood test and some special scans for the confirmation of the diagnosis if there is any indication of the scan. So in that way you can modify. So this is about station 5. So you have to work very smart. So daily at least perform 2 station 5. If you are studying with your study partner, 1 station 5 you should perform, and other your other partner. So if you are listening or you are helping your partner to do the station 5, so it means you are doing this. So okay, and which case you do, write that and work on your deficiencies which was lacking, and then read that particular case and do the examination scheme, practice the examination scheme. For those who have just started, I think divide it into the different systems. Like one day you perform the rheumatology, the other day you do the cases of the dermatology. So in that way, you will be able to cover all the cases if you are doing it for the first time. Mature candidates, they definitely know that how to do that. They can just do the previous experiences, or they can make their own scenarios as well. So if you have any question, you can post in the group, or you can ask me, right? So station 5 is very important. So, and easily with the proper scheme and with the practice, we can have 56 out of 56. It's not this that I always said that it's you can do this. It happens, and most of the candidate who pass, they get full marks in station 5. Okay, so best of luck, and if you have any question, you can ask me. So, and as you already know, I have a WhatsApp group, and I'm Dr. Sadaf Hammad, right? So you can join that group if you want, or if you have any queries, or then you can ask me. Thank you very much.